Welcome. Wendy, whereabouts are you?
I'm in Alabama.
Okay. And what's the weather like in Alabama?
It's actually it's quite cool, but it's actually nice enough to be outside to be able to enjoy it a little bit.
I love your accent, I tell you.
Thank you.
Love it. Wonderful. And Wendy, have we met before?
No, I have not. I have not met you
Okay.
before.
Okay, wonderful. Thank you very much for coming on to A Mother's Journey. People really find it very helpful to hear these stories, and you may well find it helpful to tell your story. Have you told your story before?
Yes, I have told my story. I've visited the CDC in Atlanta. I believe it was October of 2019. And I stood before that panel in that room and I told the story of my son and what we have been through in our journey.
Good for you. That's very brave of you. Right. We'd like to have you share it again. I will only interrupt. This is your show, so I'm going to interrupt only to ask questions or to raise issues that are particularly important or interesting. So we've got about 20 minutes, half an hour. Wendy, over to you.
Okay, my son, his name is Hero. He is currently 7 years old. He turned 7 in January. When he was born in 2014, I had 2 other children at the time. I had a daughter who was 15 years old, and my son, other son, was 7 years old. So this is my 3rd child. I do remember in the hospital now, looking back, when you look back, you see things that you didn't see before. You didn't know to look for these things. You're not told these things. And he was really fussy, more fussy in the hospital than my other children. And it concerned me because I thought, this is my 3rd child and I couldn't comfort my child in the hospital. He was really fussy and things like that. He was vaccinated in the hospital. 2 months later, we started the wellness visits with our doctor, and he started receiving his vaccines on schedule. After his 2-month shots, when I look back, I didn't know it then, but somewhere between the time he got those shots and his 4-month shots, he had a seizure. I didn't realize that's what it was because it didn't last long, and it resolved very quickly. So I just thought, I wasn't sure what was going on, but it didn't seem like it was anything that needed any kind of doctor's attention or anything like that. 4 months, fast forward to 4 months, I take him to the doctor. He receives his 4 months vaccinations. 8 days, on the 8th day after those vaccinations, my son went into a status seizure. I didn't know at that time what was going on. He did the same thing he did previously. And when the situation didn't resolve, I knew I had to get him to the hospital. So I get him to the hospital, and at that time he started having convulsions. I would say he probably seized for close to an hour. They were trying to get an IV and were unable to. And so one of the things, when I was at the hospital with everything going on, he's seizing on the table, I thought I had done something to my child. I didn't know what was going on. They tell me he's having seizures. And almost immediately it comes to my mind that he had his vaccines the week before. I mentioned this to the hospital staff, to the nurses. I was told, no, it couldn't be that. If it was a vaccine reaction, it would have happened within 24 to 48 hours. So that's not what this is. So even then I questioned it because I remember, hearing things, and I remember even on some of the paperwork that they give you, seizures listed as a side effect. But again, like I said, they were assuring me that it couldn't be the vaccines. That's not what it was. They got the seizure under control, and we were transferred to a children's hospital. We were there for a couple of days. And of course, everyone kept reassuring me that this was a normal childhood seizure. Again,
it lasted for an hour. It lasted an hour. People need to know that is a very long seizure.
Exactly. And they were telling me, it's a febrile seizure. Everything that I've researched about febrile seizures, they last less than 15 minutes. They don't go into status. And so, now they're telling me, well, it was a complex from the children's hospital. It was a complex febrile seizure. And I look back at his medical records, and his temperature at the time that he was in the hospital was a 100.4. So it wasn't even a very high temperature. So, I'm asking questions about that, and they're telling me it had to have been a rapid onset of fever to provoke the seizure. And that's why.
Just about the point to make is that once you've been seizing for an hour, because of the muscle spasms that go with the seizure, you are going to inevitably increase your metabolic rate, and you may well have a temperature of 100 degrees. That doesn't surprise me at all. That's a consequence of the seizure, not a cause of the seizure. So this doesn't sound like a febrile seizure at all.
Exactly. And that's why I was questioning it. And then they were telling me this was something normal in childhood. And I'm thinking to myself, I have 2 other children. I'd already been a mother for 15, 16 years. And I'm thinking, this is new to me. This doesn't sound right to me. And I tried to start researching different things over the internet, asking and talking to other people. I wasn't finding a lot at that time. I didn't have the connections that I have today when I started my research. So I spent many nights, just trying to find any sort of answer as to why my child seized on the 8th day following his vaccines and things like that. So yeah, like I said in the beginning, I wasn't getting a lot of information, and I regret to say that I continued to vaccinate my child. I was trusting still of the medical staff because I thought, who am I? I'm just a person trying to raise my child. These people have medical degrees. Surely they know what they're talking about. Surely I can trust them. And I did, unknowingly. And so he continued to receive all his vaccines on schedule. He didn't always have seizures, but, issues would arise the first year of his life. We ended up having 2 separate EEGs the first year of his life, which both came back normal. And so, I'm thinking to myself, well, maybe they are, they know what they're talking about. Certainly if it was causing any sort of damage or anything like that, these tests that we were doing would show something, because he had CT scans, he had MRIs, he had EEGs, just so many different, tests, and everything was coming back normal. And so the end of that year, he was of 2014, he was not quite a year old. He, was having more seizures. And so reluctantly, I had to put him on medication because I was going into his room at night and he would be face down seizing. And so against my better judgment and what I wanted to do, I didn't want to have to put him on medication. I'm not the type of person that wants to, be dependent on those type of things, but it was a matter of, I had no choice at that point. And so he did start some medications. And then he turned 1 year old on January the 8th, 2015. That day I took him in for his 12-month vaccines. And even that day, it was in the back of my mind. Every time I went and got those vaccines, it was in the back of my mind, am I making the right decision? So he got his vaccines that day on his birthday, 1 year old birthday. And it's almost like I could see something in his eyes that just wasn't there. Like, he was very emotionless. We had a birthday party for him, had a cake and everything. Never really had expression on his face. And looking back, I see that. Prior to this, he was having tonic-clonic seizures. Well, then after those 12-month vaccines, he started having drop seizures, and I didn't know that's what was going on. I thought maybe he was having some sort of side effect in regards to some medication they had put him on. So I give the neurologist a call and talk with him about it. And when I tell him all of the things that I'm seeing with my son, he tells me, we need to make an appointment and get you back in the office and do an EEG with Hero. So within a month, we have him back in the doctor's office to get the EEG. And now I'm getting an EEG that's saying it's not normal. He's having abnormal brain activity following those 12-month shots. And so it was like a downhill spiral from there. My son stopped. He wasn't saying a lot of words at that time, like he was just, 1 year old, but he was dancing and smiling and interactive. And I even had people comment and say that they thought he would be an early talker, all of those things, all of that, it was gone after that. He became so expressionless. The seizures were the worst things. We could not get them under control. We ended up that summer, we had a 24-hour EEG, and his seizures were so bad that they had to come in and give me a notepad. I was supposed to be clicking a button every time he had a seizure, every time I noticed him having a seizure. They ended up bringing me a notepad because it was so frequent, the amount of atonic drop seizures that he was having. So they ended up, of course, putting him on some benzo drugs and some other things to try to get the seizures under control. We had some seizure control, but it was not very good seizure control. And so we started a special diet. We tried a special diet to try to get those seizures under control. We did do that for 3 years and it did help. It was also, it allowed me to get him off of some of the medications that he was on. But like I said, from the time he had those 12-month shots, he has had numerous EEGs, and he has never had a normal EEG since those 12-month shots.
How old is Hero now?
Hero is 7 years old. He just turned 7 in January.
Right. Did anyone ever tell you that seizures are a history of seizures are a contraindication to vaccination?
No, they did not. My history of when you go to get your child vaccinated at the doctor, they tell you what vaccinations your child is going to receive. They come in and give those vaccinations, and then they give you a information sheet, hand you that information sheet, and tell you what you are supposed to do if your child has fever or anything like that. And that's pretty much my experience with vaccines. I was not informed about reactions and things prior to the vaccines.
Right. It never ceases to amaze me, the practice of medicine today. And how is Hero now? How is he doing?
Hero is doing a lot better. We had a lot of testing done, and I have successfully been able to get him off of pharmaceutical drugs. The only ones that we have are backup, in case we can't get a seizure to stop. But he's on a plant-based therapy in regards to his treatment. As far as his diet and his herbs and supplements and things like that, he's had better seizure control than, when he was on medications. He was taking medications, pharmaceutical medications, that were not even approved for children his age. I didn't even know that. And so, I just feel like my child was just a big human experiment. And so now he's 7. We have done many therapies. One of the things that helped my son the most was hyperbaric oxygen chamber therapy. So we did do that. We've done ketogenic diet. We are currently doing cease therapy, if you're familiar with that. And so that is the one that is taking the longest, and it's kind of the hardest to get through, just because of the seizures. But we have seen so many gains. He went to a child that had to be propped up against a brother in a family photo, to a boy that's smiling and happy and running around, gibbering, jabbering, and can actually follow simple commands. Because there was a time in his life that you could look at him, give him a simple command, like, go get mommy your shoes, and he would not even know what you were talking about. So he has come a long way, and we still have a long way to go, but we're not giving up. He deserves the best, like all of our kids do.
Wonderful. Well done. He's lucky to have you as a mother. So
Thank you.
it's a very sad story. It's a sad indictment of the medical profession, I'm afraid. It saddens me enormously, but keep doing what you're doing. It's much better. He's much better in your hands than in the hands of doctors, quite clearly. But keep in touch with us. Let us know. And thank you very much for sharing your story. I really appreciate it.
Yes, thank you as well. I really appreciated this opportunity.
Thank you so much.
Bye-bye.
Bye-bye.